In October last year, large numbers of New Zealanders wrote to the Health Minister Tony Rayau expressing concern over the safety of a swine flu vaccine produced by the Baxter Corporation. This company had been at the centre of a scandal after newspapers reported that live bird flu virus was found in 72 kilograms of the swine flu vaccine after it was sent to 16 countries. The New Zealand government had bought 300,000 doses of swine flu vaccine from this company, and Tony Rayau sent those concerned an official government letter assuring them that the suspect vaccine would be kept as an insurance policy and would only be used in an emergency pandemic situation. He also stated that no mass vaccination on swine flu would take place in New Zealand. He did, however, confirm the seasonal flu vaccine for 2010 would contain a swine flu component supplied by different companies. On the 21st of January 2010, the Ministry of Health website surprisingly announced that a swine flu vaccination program will in fact take place using the controversial Baxter vaccine. In February, health workers will be inoculated first, followed by people under 65 years of age, including children with certain medical conditions, pregnant women, the morbidly obese, and all children aged 6 months to 5 years who are Maori, Pacific Islander, or from high deprivation areas. It is obvious that our health minister was lying to us about his intentions, and is clearly only concerned about recouping the costs outlaid in buying the suspect vaccine in the first place. What most New Zealanders don't know is that more and more doctors worldwide are risking their medical licenses by coming out publicly and voicing their concerns about the questionable safety of vaccines and the chemicals used in them.
We are tracking H1N1, and health officials here in the U.S. saying it's too soon to know if a one-shot vaccine for the virus will actually be effective. With me now, Dr. Kent Holtorf, who is an expert on infectious diseases. Doctor, thanks very much. All right, now what do you think of the vaccination?
You know, I have more concern about the vaccine than I do about the swine flu. It's been rushed to market. There are high levels of adjuncts, which basically make it more potent, so they can. It's kind of an unrefined method that they use. They had to use these high levels of these adjuncts, including
thimerosal. It's an antiseptic preservative, and hasn't that been linked in some cases to autism?
It has, and you look, it's been shown to cause autism in children with mitochondrial dysfunction. Now, and other is controversial, though highly implicated. And the problem is you don't know if your child has mitochondrial dysfunction. I also worry about children and people who have blood-brain barrier dysfunction or it's not fully developed, which include children, pregnant women, chronic neurological illnesses, and chronic fatigue syndrome and fibromyalgia. I've seen these people have been devastated by these infections.
All right, would you give it to your kids?
I definitely would not.
You would not. All right. And in fairness, I've talked to 3 doctors in 3 days now, and all 3 have said absolutely they would give it to their kids. They intend to give it to their kids. They're going to take it themselves, but you say no.
I definitely would not. I've seen it devastate people with chronic fatigue syndrome, fibromyalgia, highly implicated, again, in autism. I think you're rolling the dice. It's a proven neurotoxin. It has 25,000 times the level of mercury than would be considered toxic if it was a food or water. Right. And levels get up, serum levels up to 100 times the toxic level. It's too big of a risk.
All right. Dr. Kent Holtorf, an expert on infectious diseases.
In the case of pregnant women and young children, please consider the following. As of July the 1st, 2007, under the Washington State Department of Health, the influenza vaccine mercury limit for pregnant women and children under 3 years is 1 microgram per 0.5 milliliter dose. The amount of mercury used in most multiviral swine flu vaccines is 25 micrograms per 0.5 milliliter dose. This is 25 times the level considered safe in normal circumstances. Another additive which is in the Baxter vaccination scheduled for the coming inoculation is polysorbate 80, better known by the trade name tween 80. Tests carried out on rats with this chemical resulted in serious defects in fertility. Put in plain English, polysorbate 80 can affect your immune system and cause severe anaphylactic shock, which can kill. Is it surprising that there have been large amounts of severe reactions from the swine flu vaccinations, including multiple reports of women having miscarriages? Due to the severe reactions, the Canadian authorities are conducting the appropriate investigations on the vaccines and have recalled a batch of vaccine from the GlaxoSmithKline company, a spokesman reported. Not only do we need to be concerned about the swine flu vaccinations coming up, we also need to investigate more thoroughly the many deaths occurring around the world immediately after teenage girls received the cervical cancer vaccine Gardasil. 3 of them were from New Zealand.
CDC recommends that all girls starting at 11 or 12 years old get vaccinated against cervical cancer. It's a disease that kills 4,000 women each year. But now 2 studies just published in the Journal of the American Medical Association are raising new questions about the safety of this vaccine. Here's ABC's John McKenzie.
Welcome back.
It's a dilemma for millions of parents across the country. Whether to vaccinate their daughters against a sexually transmitted virus that can cause cervical cancer.
It's for her own health. I did it.
Gardasil, a series of 3 shots given over 6 months, has been heavily promoted.
That the right time to protect her is now.
So far, more than 7 million Americans have received Gardasil injections. The study identifies 12,000 medical problems after vaccination. Most are mild, dizziness, headache, and fainting. But there are more than 700 reports of serious medical problems, including blood clots, autoimmune disorders, and 32 cases of death.
These are initial reports, and I don't think that we can assume necessarily a cause and effect relationship, as many of these women had other underlying medical conditions.
Most doctors I know have stopped giving this vaccine because of the safety issues around it now.
As a gynecologist, Dr. Jacques Moritz sees the deadly effects of cervical cancer. He is also the father of an 11-year-old daughter.
I'm not going to have my daughter vaccinated right now.
Why not?
Because I think there's other ways to prevent cervical cancer, the old standards, pap smear, routine exams, and this vaccine, I just don't know enough about it yet.
Making the decision to vaccinate all the more difficult for many parents and pediatricians.
I feel that we don't have enough information or data yet to be able to say that this will prevent cervical cancer.
For Good Morning America, John McKenzie, ABC News, New York.
The controversy is clear here. Let's bring in from Boston, ABC News Chief Medical Editor Dr. Tim Johnson. And Dr. Tim, the headline for me here is that this is the first time that even you say, so confounding, you can't make a recommendation.
As you know, Chris, I'm very much in favor of all other childhood vaccines, but in this case, I don't think we yet know the long-term benefits or risks. It does prevent HPV infection that should prevent cervical cancer long-term. The risk we still don't know long-term. So I'm taking a pass on this one and saying to parents, look, study the issue, read the editorial in the Journal this week. It's a great editorial. Talk to your doctor about it, and maybe wait a little bit like Dr. Moritz is going to do. Don't jump into this one because I think we still have a lot to learn.
So why isn't the directive simply, don't do it, it's risky?
Because we know it does what it says, it prevents HPV infections, and we know that some parents are very concerned about that and want to prevent that, hoping it will prevent cervical cancer. They have a right to do it. It's approved by the FDA. It's not wildly dangerous. We already know that. So that's your choice. I'm not saying it's a bad choice. I'm just not prepared to make a recommendation.
So you have to inform yourself. Dr. Tim, thank you very much.
On this one for sure, yeah.
So if you want more information out there, go to abcnews.com. There's information about the vaccine there for you.